Thank you.
All right, I will go first and share my screen. Now, the first topic for today, training session will be alcoholism. So, have you ever thought about how a casual drink can sometimes turn into something more? So now let's talk about how casual drink can sometimes turn into a serious problem, alcoholism. It doesn't happen overnight, and it starts with social drinking oftentimes, maybe a beer after work or wine at dinner. Over time, some people begin drinking more frequently, not just for fun, but to cope with stress, sadness, or boredom. Their brain starts relying on alcohol to feel normal. Eventually, they lose control. They can't stop even when they want to. Well, what is alcohol exactly? Simply put, it's a drink made from fermented sugars found in things like grapes, grains, or fruits. Some drinks like vodka or whiskey go through an extra process called distillation to make them stronger. But not all alcohol is the same. Beer is usually around 5% alcohol, which is pretty mild, while wine is stronger, about 11 to 13%. And then there's a hard liquid like vodka, rum, whiskey, which can be 40% alcohol or more. That's why a single shot of liquor hits harder than a whole beer. So understanding what you're drinking helps you make smarter choices. A glass of wine with dinner is very different from downing multiple shots in an hour. Well, why do people drink? Uh, there are lots of reasons for that. Some people enjoy the taste or love trying new cocktails, while for others, it's about the way alcohol makes them feel, like more relaxed, confident, or social. Ever notice how a drink can lose people up at parties? Well, that's alcohol acting as a social lubricant. But if we dig deeper, all drinking motives fall into four big categories: social, coping, enhancement, conformity, and I will explain one by one. People drink to fit in or celebrate. That's for one. For two, using alcohol to escape stress or sadness. For three, drinking for the buzz or excitement. So, last but not the least, they drink because others are doing so. The problem starts when drinking becomes the only way to have fun or deal with problems. That's when it gets risky. So that's the reason why people drink. Well, let's be real now. Drinking too much, or even just once, can mess you up. Uh, you ever seen someone black out, say things they regret, or wake up with a brutal hangover? That's your body telling you it's hard. it's had too much. But the real danger is long-term heavy drinking because it can ruin relationships, destroy your health, get you in trouble, and it may drain your wallet. Uh, for ruined relationships, you might have fights and you broken trust, isolation in your relationship, destroy your health, that is for sure. You may have liver disease, brain damage, even cancer, because alcohol is considered, the thing that can cause cancer. Uh, Sometimes heavy drinking can get you in trouble. Uh, you may have driving under the influence. You can have fines for that, or even going to jail. Uh, next, last but not least, you may not lose your jobs. You may have hospital bills for drinking too much. Uh, is there a bottom line for that? Well, drinking in moderation is fine, but losing control can cost you everything. Now let's take a look at alcohol consumption in Africa. These images on the PPT slide are based on data from the WHO Global Status Report on alcohol and health and treatment of substance use disorders. So this data was published in June 2024. It's the latest data. And it shows that Africa's overall drinking rates are moderate, but the average daily alcohol intake is actually quite high, around 33.5 grams per person, which is above the global average. Now, when we break it down by drink types, beer makes up 36.3%, wine is about 5.2%, spirits account for 13.2%. And as for other drinks, there is a whopping 45.3%. Why is these other drinks so high? Well, a big reason is traditional homemade brews, things like palm wine, sorghum beer, honey wine, and banana beer. These are especially common in rural areas, but they can be inconsistent in both safety and alcohol stress. Another issue is that some of these other category includes dangerous, illegally produced alcohol, like counterfeit liquor made with industrial alcohol or even methanol. These fake drinks are a serious health hazard. Well, why do people develop alcohol use disorder? Uh, well, now first, let me ask you something. Have you ever noticed how alcohol actually tastes pretty bad at first? If you think about it, no one, not babies, not first-time drinkers, actually likes the taste of alcohol naturally. Because it's bitter, it burns. So why do people keep drinking it? And why do some end up with alcohol use disorder? The answer lies in our brains. Even though alcohol tastes unpleasant, our brain's reward system gets hijacked. When we drink, two key chemicals, glutamate and gamma aminobutyric acid, or GABA in short. Uh, the glutamate is the chemical which excites the brain, while GABA calms it down. These two chemicals in our brain uh, go out of balance. This creates a feel-good effect, making us associate alcohol with pleasure, even if our taste buds disagree with that. Over time, the brain starts craving that artificial reward, pushing people to drink more to get the same buzz. That's how a habit can turn into dependence, because the brain learns to chase the pleasure, not the taste. So this is the mechanism behind the alcohol abuse. Well, let's talk about how your body absorbs alcohol, because where it goes determines how fast you feel it. First up, the stomach. If you drink on an empty stomach, only about 10 to 20% of the alcohol gets absorbed there. The rest races straight to your intestines. But eat something first helps, uh, because food slows things down. So your stomach absorbs up to 30%, delaying the buzz. Well, now the real action happens in the small intestine, specifically the duodenum and jejunum. This is where 70 to 80% of alcohol gets absorbed, thanks to a huge surface area. You can imagine a 200 square meter sponge. That is very big area. And it starts fast within 5 minutes of your first sip. So that's how alcohol reaches to different parts of your body, different parts of your body system. So once alcohol hits your bloodstream, your liver gets first dips. About 80% goes straight there while they pour away. But here's the twist, 10 to 15% slips past the liver entirely, zooming to your brain, lungs, and other organs. That's why you feel tipsy fast. The brain alcohol levels match your blood alcohol content in just 30 minutes. Your body then eliminates a tiny bit, about 5 to 8% through your breath. That's how the breath analyzers work. 1 to 2% in your urine, and a whisper about 0.1 to 0.7% in your sweat. And the rest goes back to the liver for round 2 of cleanup. So your liver works hard. But alcohol's a sneaky traveler. It reaches your brain before the liver can catch up. So this is something you really need to take seriously. Have you ever blacked out after drinking or suffered a brutal hangover? Well, those are warning signs, not just bad nights, And here's the reason. Blackouts happen when alcohol fries your brain's memory circuits. For the hangovers, that's your brain in rebellion. As alcohol leaves, it overreacts, causing headaches, nauseas, and that's never again feeling. But the real damage is long term. You can check the image. Alcohol contributes to heart disease, liver cirrhosis, cancers in your throat, mouth, esophagus, and even violence or self-harm. It's not just your liver, it's your whole body paying the price. So that's how the alcohol harm your body. Well, let's break down how alcohol actually harm your body now. It's not just about getting drunk. Alcohol attacks your organs in four sneaky ways. Oxidative stress, inflammation, apoptosis, fibrosis. For the first, alcohol creates toxic byproducts that fries your cells like rust on metal. And your liver and other organs swell up trying to fight the damage. So that's when inflammation happens. As for apoptosis, this is a fancy word for cell suicide, which means alcohol forces healthy cells to self-destruct. As for fibrosis, repeated injury turns soft, flexible tissue into stiff scars. You can think of the liver turning into leather. And as a matter of fact, the scary part happens every time you drink too much. So it happens every time you drink too much. It's not just chronic heavy drinking. Then how to reduce alcohol's harmful effects. The good news is you can drink more safely. And here's how. For the first, control alcohol intake. For men, maximum 25 grams per day. That is about 2 beers or 1 shot. For a woman, no more than 15 grams per day. That is 1 beer or half shot. And never binge. That is no more than 2 shots at once. And you need to prepare your body before drinking. Never drink empty-handed. You need to do is to eat first. And take B vitamins to help your liver. Sip slowly and chase with water, not soda, because it can speed up alcohol absorption. After drinking, replenish with electrolytes like the liver nutrients, for example, milk, sea salt, and also don't pass out right away after the drinking. Let your body process the alcohol first. And you need to get annual checkups because your liver can't scream for help until it's too late. Because we know that liver is the silent organ inside our body. You may notice anything when your liver is getting injured or damaged. Once you have the feeling of feeling not right in your liver, it's already too late. So regular checkup is the key if you drink oftentimes. If you are physically dependent on alcohol, quitting cold turkey isn't just hard, it's dangerous. Your body may go into shock. So that's why doctors use careful detox plans with medications and monitoring. Your safety always comes first. So the quitting is a process, not a one step thing. If you have drinking problem, go to a rehab, uh, go for advices from a doctor. Greenwood products also help in some way. The weak 酒精清 fresh drink isn't just a hangover cure, it's a detox powerhouse. Uh, and Here's the mechanism inside. The alcohol metabolism boosters are in there, like kudzu root and Havania seed. These two ingredients help speed up breakdown of toxins. And there's liver protection squad in this product as well, like licorice, mulberry, and turmeric. They fight inflammation like tiny firefighters inside your body. Also, there is stomach shield like chitosan. It forms a protective gel coating to prevent alcohol burns on your stomach lining and your intestine lining. Well, you can think of weak 酒精清 as an emergency kit for your organs after drinking. And also it helps before you take shots, have drinking. So the second product we recommend is Greenwood Blueberry Super Nutrition, which has blueberry extract as main ingredient. We know that blueberries contain anthocyanins, which are powerful anti-inflammatory and antioxidant compounds that help protect liver cells membranes. Another main ingredient effective is fructose oligosaccharides, which help fix gut damage from drinking. Yes, like you think, alcohol wrecks your gut too. And soybean lecithin also helps repair liver cell membranes. The bonus here are this product is also packed with vitamins and minerals to refuel what alcohol drains inside your body. So nutrition is good, is beneficial for your health. Well, Greenwood Spirulina Plus capsule is also recommended here. Spirulina is a nutrient-dense blue-green algae with comprehensive health benefits. It has phycocyanin, which provides antioxidant and anti-inflammatory effects, supporting liver detoxification. Spirulina is also rich in vitamins and minerals, which aids in the synthesis of metabolic enzymes. So they help enhance alcohol metabolism. Meanwhile, it is high in chlorophyll and polysaccharides, which protects gastric mucosa by forming a soothing barrier inside your stomach and your gut. Well, your body is the only is the only thing you've got. So drink smart, protect it, and never hesitate to ask for help if alcohol is becoming a problem for you. You can also support your body daily with grounded science-backed supplements formulated with liver protecting herbs and essential nutrients to counteract alcohol's effects. So, well, that's the first beauty slide. Now I'm gonna share with you another one. So this is the second topic for my part. So this topic is about tooth decay and how to care your dental health with Greenwork product. Uh, as everyone knows that a confident smile is one of our most important assets in social interactions. But when dental problems appear, whether it's yellowing teeth, dark spots on your teeth, brown stains, or bad breath, it can be embarrassing oftentimes. Then what really causes tooth decay then? Well, it's not just about sugar, and we will talk about that later. But here, the good news is that we know how cavities develop. We can fight them better. There's no systemic health without oral health. That is for sure. Because your mouth is the front door to your whole body's health. Did you know that your mouth contains over 700 types of bacteria? While most are harmless, some can cause trouble beyond cavities. For example, gum disease bacteria can enter your bloodstream, potentially affecting your heart and making diabetes harder to control. Pregnant women with poor oral health may face higher risks of complications. And here's something even surprising. Hepatitis B can spread through oral fluids too. That's why dentists see a healthy mouth means a healthier you. Well, now let's meet the team that makes up your teeth. The white part you see on the PPT is the enamel, the hardest substance in your body, and even stronger than bone, it is the outermost layer of your teeth. Here is a fun fact about enamel. When measured by Vickers hardness, tooth enamel is 4 to 5 times harder than bones. Because enamel consists of 96% in organic minerals, primarily hydroxy apatite crystals. It lacks cellular structure and cannot regenerate. While in contrast, bone is about 70% in organic minerals and 30% collagen, containing living cells that enable continuous remodeling. So that's the basic difference between enamel and your bones and how it decides the hardness of them. However, despite its extreme hardness, enamel is vulnerable to acid erosion. It begins to dissolve with pH value is less than 5.5. This is why we often compare tooth enamel as glass. As it's the hardest substance in your body, but just like glass, it can crack or shatter under pressure. While bone is like steel-reinforced rubber, it's tough and durable, yet flexible enough to bend without breaking. Underneath the enamel is dentin, which is sensitive. That's why you feel pain when a cavity gets deep. The root has cementum covering it, and inside every tooth is living pulp with nerves and blood vessels. Kids have 20 trillion wells till that fall out, while adults get 28 to 32 permanent teeth, including the wisdom teeth. Though not everyone develops all four wisdom teeth. Wisdom teeth are like that extra luggage. Sometimes they're useful, but oftentimes they're better to be removed because many people's wisdom tooth can become deformed. Mm, They can, affect their daily chewing or, living. It can be painful sometimes, and they can become inflammation. So that is why wisdom tooth sometimes are to be removed. Then what is tooth decay? Well, tooth decay isn't just holes in teeth. It's actually an infectious disease. Harmful bacteria from sticky colonies like called plaque that eat sugars and produce acids. These acids create tunnels through your tooth like termites in wood. In severe cases, the infection can spread through your body, even becoming life-threatening. That's also a two-way street between diabetes and tooth decay, as high blood sugar feeds mouth bacteria, while mouth infections make diabetes harder to control. The scary part is that it's one of the most common diseases after colds. Four key factors team up to cause cavities. First, the bacteria army in your mouth. Second, what you eat matters more than how much sugars. Sticky foods that cling to teeth are the worst. Third, your personal defenses counts, like the saliva quality, tooth shape, and even genetics matter. As a matter of fact, some people naturally have more cavity-fighting minerals in their saliva. Fourth, time matters too. It takes months for cavities to form, which is why regular checkups catch problems early when they are easiest to fix. So these are the factors contributing to the tooth decay. But not all cavities are created equal. Acute decay hits fast. We often see this in cancer patients receiving radiation. Chronic decay grows slowly over years. turning teeth dark brown. The sneakiest type is recurrent decay that hides under fillings when treatment isn't perfect. And here is a tip for you. Those weird white or brown stains on your teeth might not be cavities yet. If you catch them early with fluoride toothpaste and dentist visits, your teeth can actually repair themselves, and there is no drilling needed. So science proves it works 63% of the time. Now let's track how cavity develops. At first stage, white spots appear. There's no pain yet, but the enamel is weakening. And at the second stage, the tooth turns brown and feels rough. At stage 3, a small forms with sudden zings of pain from cold sweats. At final stage, constant pain keeping you awake at night. Still, the great news is that regular dental visits can spot challenges at early stage when we can often reverse the damage. Once the decay progresses and creates an actual hole in the tooth, it can't heal on its own anymore. So early treatment and prevention are always better. Neglecting cavities is like ignoring a check engine light. Small problems can become big very soon. First comes toothache that ruins sleep and work. Then infections can spread to the bone through your bloodstream, causing swelling that needs emergency care. Next comes difficulty eating, leading to poor nutrition. The final stage is tooth loss that affects speech and facial shape. But here's the silver lining in it. Modern dentistry can stop this at any stage. Even better, most of this is preventable with simple daily care. Now let's talk about real-world defense against tooth decay. Your diet is your first shield. Crunchy veggies and fiber-rich foods actually scrub your teeth while you chew. Those vitamins are like reinforcements for your enamel. And here is the truth about sugar. It's not the amount, but how often you eat that matters. Every soda sip restarts the 20-minute acid attack on your teeth. And you guess what? Stress and poor sleep also weaken your mouth defense, just like they do your immune system. What you can do is to brush your teeth every morning and each night. Then follow up with floss and interdental brushes. Don't forget to rinse regularly. That's your daily defense for a healthy mouth. Now, Greenworld Herbs toothpaste is a science-backed oral protection for you. This toothpaste combines natural herb and modern technology to actually protect your oral health. Well, now let's break down what each ingredient does for you. The xylitol isn't just a sweetener. It actually blocks cavity, causing bacteria from breeding on sugars. while helping rebuild weakened enamel. While mint extract does more than freshening breath, it specifically targets harmful bacteria like uh, Porphyromonas gingivalis, which is one of the main culprits behind gum disease. The natural compounds in in mint extract also soothe irritated gums and reduce inflammation that causes bleeding. Honeysuckle provides broad spectrum antibacterial action, effective against the bacterial mix that forms plaque in your mouth, in your teeth. Its anti-inflammatory properties help calm gum redness and sensitivity. Radix ascites root is commonly used in traditional medicine as an antiviral protection, particularly helpful during cold or flu season when oral viruses are common. So you can use these herbs toothpaste twice each day to protect your dental health. And if you always supervise your child when they are brushing their teeth and they'll need your help to do it properly. The next product we recommend is Propolis Plus Capsule. Propolis is a natural antibiotic as beings use it to sterilize their hives. For a mouse, it's like having a microscopic repair crew. You can open the capsule and mix the inner content with water, then gargle for around 3 minutes to relieve canker sores. And you can also try this. Dip your floss in the mixture for germ fighting between teeth where brushes can't reach. This is a good way, to fight the bacteria inside your mouth. Another product we recommend is Super CoQ10 capsule. You can think of CoQ10 as a spark plug in your cell's engines because it helps convert food into usable energy. Aging or gum disease drains this natural energy compound. It works 2 ways in your body. If you swallow the CoQ10 capsule, it fuels gum repair from within. On the other hand, if your gums is bleeding, you can twist open a capsule, mix the powder with a few drops of water to form a paste, and gently rub it on the sore gums. And here is a fun fact. 90% of gum disease patients show CoQ10 deficiency. And here's why you need CoQ10 capsule. When the gums bleeding, bad mouth bacteria can hitch a ride through your blood straight to your heart, increasing risks for heart disease or over time. So that is the time you need to improve your heart function by taking CoQ10 for the purpose to prevent further harm in your heart system. Now I'm going to share a professional brushing technique, the best method. Maybe some of you have already know this. but it's never, too much, right? You can see on the PPT, there is a 45-degree angle between the toothbrush and the teeth. This isn't just for show. It allows the bristles to sneak into the trenches of your gums. That is what we call the gingival sulcus, where 80% of cavities start. And here is a common mistake alert. Many people scrub sideways like they're cleaning floors. That's actually saws at your teeth. The right move is short, gentle back and forth vibrations, and about 4 to 5 times per second to break up plaque. So the gesture should be gentle. Uh, the brush should be in vibration forms, to break up the plaque. And also here's another tip for you. You may divide your mouth into 4 zones. Just brush 30 seconds per zone. This is faster than replying to a WeChat message. So this is the best method for brushing teeth. For babies between year 0 to year 3, for little babies, parents help their baby wipe gums and new teeth with a soft cloth. For kids older than this, they can use silicone brush twice daily, especially before bed. Also, that is done by the parents. As for kids about 3 to 6 years old who are prone to cavities, dentist visits every 6 months are needed, and each day they can use a rice grain-sized fluoride toothpaste to brush their teeth, and parents should watch them brush and help them when necessary. And you can ask the dentist about fluoride varnish at age 6. Baby teeth set up adult teeth for life, so they need more care. Here's oral care guidelines, special oral care tips for moms and seniors. For pregnant ladies, in first 3 months, they can eat iron-rich foods like spinach. Well, and folate. This is prenatal vitamins as the baby's teeth are forming. During months 4 to 7, choose cheese or yogurt for calcium boost. Sunlight exposure is important as vitamin D is needed for strong teeth. Or they can simply choose green-rolled calcium capsule or compound calcium powder. Then for last month and after birth, they can skip non-urgent dental work like whitening, as hormones make gums extra sensitive, and that is not safe for babies. As for seniors, they should watch for gums pulling back. In this case, they need to use soft brushes. If they have loose or missing teeth, they may ask about implants or dentures as soon as possible. If they have mouth sores that don't heal, that could signal other issues, and they need to see the dentist. Since hormone changes and dry mouths raise the risk for both groups, drink adequate amount of water and chew sugar-free gum helps with dental health. Well, that's the end of the presentation, and we need to always remember the mouth isn't separate from our health, and dental health matters, and small habits create big wins. Well, thank you for listening. And just now, Madam Linda remind me of the chat box. There are some questions there. Let's see. Does our toothpaste have fluoride? If not, why? That is a very good question. From the ingredients of the toothpaste, I see no fluoride. That is that toothpaste is a herbs toothpaste. So its main purpose is to help with the dental problems, especially the sores in your mouth, the inflammation. It helps with the inflammation. Also, it helps curb the bacteria breed inside your mouth. So different toothpaste have different purpose for use, right? Does Green Road toothpaste have fluoride? That is the same question. Since fluoride is harmful to the body if swallowing, that is a very good reminder. Too much fluoride, there is a limit of intake of fluoride inside your body. Right? When we brush our teeth, we do not swallow it, right? So we will flush our mouth with water. So that amount of fluoride is not harmful enough to your body. So for kids, that is why we want our parents to watch our kids while brushing their teeth to prevent they swallow the toothpaste after brushing their teeth. Well, I think that's all about the question. Thank you very much.
Okay,
So now it's time for Miss Linda. Please go
Okay.
ahead.
Hello. Dear family member in the Africa region, my name is Linda Zheng. Nice to meet you. Let's continue our discussion on dental health topics. Next, focusing on dental abscess. Essentially, this condition occurs when dental caries tooth decay progresses severely, leading to inflammation and eventually pus formation. In this session, we will cover types of dental abscess, what categories exist, how they develop from early decay to infection, medical treatment options, how dentists address it, prevention tips, how to avoid it in the first place. Let's dive in and learn how to protect our oral health. Okay, next. What is a dental abscess? Let's break it down. There are two main types. The first is periapical abscess. The second is periodontal abscess. The first one is all we will cover today. Next time, we will dive into gum disease. So, what periapical abscess? This type of infection starts inside your tooth when a cavity, dental caries, progresses deeply, or a tooth cracks. A bacteria invade the pulp chamber, the sensitive inner tissue containing nerves and blood vessels. The pulp gets infected, and soon pus builds up at the root tip. That's the periapical area. Ouch! You will feel throbbing pain, especially when biting. A tremor like a hit to the tooth can also cause this. Okay, let's see the progression of acute suppurative periapical periodontitis, a severe dental infection that develops when bacteria invade the periapical tissues. This condition evolves through three distinct clinical stages, each with its own characteristics and symptoms. Stage 1, periapical abscess stage. The infection begins here, localized with the periapical region of the affected tooth. At this point, pus starts accumulating, but it's still confined to the periodontal ligament space and alveolar bone. Patients typically report severe throbbing pain that intensifies with biting or chewing. You will also notice tenderness to percussion. Gentle tapping on the tooth will elicit significant discomfort. The tooth may feel slightly elevated in the socket due to inflammatory exudate, but visible gum swelling isn't always present yet. Stage 2, that periosteoabscess stage. If left untreated, the infection spreads beyond the bone and collects beneath the periosteum, the dense connective tissue covering the jawbone. This is where things get more serious. The pain remains intense, but now you will observe visible swelling and redness in the gums near the affected tooth. The swelling is firm and localized because the periosteum limits pus expansion. Patients might also develop facial swelling if the abscess involves maxillary or mandibular teeth. Tooth mobility increases due to bone destruction, and systemic symptoms like mild fever or malaise can appear as the body fights the infection. Stage 3, submucosal abscess stage. In the final stage, the pus erodes through the periosteum and spreads into the softer submucosal tissue. Here, the swelling becomes more diffuse and fluctuant, softer to the tooth, because the pus now occupies the looser connective tissue space. Interestingly, some patients report temporary pain relief at this stage. Why? Because tissue pressure decreases as the abscess ruptures internally. However, don't be fooled. The infection is still active and now poses a higher risk of spreading to deeper facial spaces. Facial swelling worsens, and systemic symptoms like fever, fatigue, or even lymphadenopathy may become prominent. Now that we have explored the acute suppurative form, let's shift our focus to its chronic counterpart, chronic periapical periodontitis. Unlike the intense pain and swelling seen in acute cases, This condition often flies under the radar, but don't mistake its quiet nature for insignificance. Chronic inflammation can slightly damage periapical tissues, making early detection crucial. Let's walk through its clinical presentation. The hallmark of chronic periapical periodontitis, asymptomatic or mild symptoms. Many patients only discover it incidentally during routine exams or x-rays. Why? Because the infection develops slowly, allowing the body to ward off the inflammation. But when symptoms do appear, they are subtle, mild chewing discomfort, a vague sense of pressure or tenderness when biting, a gingival sinus tract, a small, painless pustule or pimple on the gum, often near the root apex. This fistula drains pus, relieving pressure, which explains why pain is rare. Always ask about their dental history. Most cases stem from previous pulpitis that progressed to necrosis. Some patients report episodes of transient swelling or discomfort that resolves spontaneously, indicating chronic inflammation with intermittent drainage. Remember, the absence of pain doesn't mean absence of disease. Okay, next, never underestimate periapical infection beyond local abscesses. Untreated cases can spread dangerously, causing facial cellulitis or even jaw osteomyelitis. Worse still, bacteria may enter circulation, triggering life-threatening sepsis. Let me explain how a tooth infection can become life-threatening when bacteria from an infected tooth enter the bloodstream, which happens easily during chewing or dental work. They travel throughout your body. These germs particularly target damaged heart valves, where they cling and grow, causing endocarditis. This infection damages heart function and can lead to heart failure. At the same time, multiplying bacteria trigger a massive inflammatory response called sepsis. Your whole body reacts, fever spikes, blood pressure drops, and organs begin failing. These bacteria can also spread to your brain, kidneys, and joints. Root canal therapy, the gold standard treatment for pulp necrosis and periapical diseases. This biological-based procedure doesn't just relieve pain, it preserves natural teeth while eliminating infection. Let's break down its key phrase and objective. For non-purulent cases, no active pus inflammation, we follow this conservative root canal protocol. Number one, preparation. Create access. Determine length. Apex locator, a radiograph. Enlarge canals. gently with continuously sodium hypochlorite irrigation. Number two, disinfection. Place calcium hydroxide dressing for 1 to 2 weeks to eliminate residue bacteria. Number three, obturation. Fill only when asymptomatic. Then a 3D seal with gutter patcher by bioceramic sealer. Number four, restoration. Final composite or crown to prevent micro leakage. When managing acute periapical abscess, purulent cases, our approach differs fundamentally from standard root canal therapy in three critical aspects. Emergency phase comes first, unlike non-purulent cases where we proceed directly to cleaning, shaping. Purulent infections require immediate drainage. We must surgically incise the abscess under local anesthesia, vital as inflamed tissue is more sensitive. Leave the pulp chamber open for 2 to 3 days for continuous drainage. Initiate antibiotics, amoxicillin, and metronidazole to control spreading infection. If you still find it difficult to visualize, we can watch a short video to get a general understanding of this surgical procedure. Okay, let's see. See, it's him. That's right. Wow, that video really showed how painful dental problems can be, didn't it? Nobody wants to go through that. The good news is most tooth troubles are completely preventable if we take some simple daily steps. Brush properly for 2 minutes or 3 minutes twice daily. Don't skip flossing. Cut back on sugary, acidic foods, especially between meals. See your dentist before pain starts. Small fixes beat big procedures. Protect your tooth from damage. No cracking nuts or eyes. Strong immunity control diabetes helps too. Prevention is always better than treatment. Want a natural way to fight cavities and gum disease? Try Greenwood herb toothpaste. Its honeysuckle breaks down harmful bacteria films, while peppermint, menthol zaps bad breath gems. Ascetic root even tackles tough bacteria like methicillin resistant uh, Staphylococcus aureus. Plus, xylitol stuffs cavity, causing bacteria of their favorite food, sugar. Brush smarter, not harder. Your mouth will thank you. The next, meet Greenwald Propolis Plus capsule, your gum's new best friend. This little powerhouse fights bad bacteria, even the stubborn ones that cause cavities and gum disease. Calm angry, swollen gums, and even helps heal
Irma,
mouth
Irma, close your
more
eyes.
faster.
Close your eyes. Close
Here's
your eyes.
how to use it.
Take your
For
brain.
heavy mouth rinse, mix 2 capsules with water. Switch for 30 to 60 seconds. No swallowing. For targeted relief, make a paste with 2 capsules and a few water drops. Then dab it on sore gums or ulcers. Bonus, it's so effective. Even dentists use properly in periodontal treatment. Okay, next we are going to focus on gum disease because understanding it is key to maintaining excellent oral health. Gum health is something we should never ignore. Proper oral care is essential, and with Greenwell's premium products, we can achieve a healthier mouth together. So let's dive in and learn how to keep our gums and our smiles strong and vibrant. Here is a startling fact. Gum disease is the #1 reason adults lose their teeth, more than cavities or accidents. Why? Let me explain with an analogy. Your teeth are like trees, and your gums and bone are the soil holding them in place. There are 4 critical components in this dental ecosystem: the bone foundation, alveolar bone, the sock absorbs periodontal ligament. The protective cells, gingiva, and root coating, a cementum. When gum disease strikes, it's like termites attacking this entire system. We categorize these attacks into 4 main types, from mild gingivitis to serious systemic manifestation. Now, let's talk about why your dentist cares about more than just your teeth. Recent research shows gum disease acts like a slow poison for your entire body. The inflammation in your gums releases chemicals that travel through your bloodstream. For diabetes patients, it's a vicious cycle. High blood sugar feeds gum infections, which then make blood sugar harder to control. For heart health, chronic gum inflammation is comparable to smoking in its effect on cardiovascular risks. Pregnant women should pay special attention. The toxins from gum infections can trigger early labor, similar to how infections elsewhere in the body might. And emerging research shows Alzheimer's patients often have the history of severe gum disease. This isn't about scaring you, it's about empowering you with knowledge to protect your overall health. So how do we catch this problem earlier? Let me show you how we look for during an examination. Healthy gums should have a stippled texture and coral pink color, like the surface of an orange peel. When we perform probing, gentle inserting a thin instrument between the tooth and gum, there should be no bleeding. We carefully measure the probing depth from the gum margin to the base of the sulcus with 3 milliliters or less considered healthy. Deeper measurements may indicate areas where bacteria can accumulate. If you are having trouble visualizing this 1 to 3 milliliters depth, let me introduce 2 key medical terms, the attached gingiva and free gingiva. The attached gingiva is a tough, sturdy part firmly glued to your jawbone. You can't lift it with a pole. It's like the body armor for your teeth. It handles daily chewing and brushing while blocking bacteria from going deeper. Then there's the free gingiva, the soft, movable collar around each tooth. It forms a tiny pocket called a sulcus that's normally 1 to 3 milliliters deep. This is your mouth's early warming system. If it turns red, puffy, or bleeds easily, that's often the first sign of trouble. Let's start by understanding gingival diseases. These are conditions that affect the gum tissue, including inflammation and the manifestations of systemic diseases, typically without damaging deeper periodontal structures. They fall into 2 main categories: plaque-induced gingivitis, the most common type, and non-plaque-induced gingival disorders. However, we need to pay special attention to plaque-induced gingivitis. It's a major gateway to periodontitis, making prevention absolutely crucial. Let's look at some eye-opening statistics from Africa, where research gives us important insights. In some communities, up to 90% of children with poor oral hygiene show gum disease. That's nearly universal. But even in more developed areas, 35 to 75% of adults are affected. Why such high numbers? Several factors: limited access to care, dietary changes, and competing health priorities. The adolescent number are particularly striking. 68% median prevalence during those turbulent puberty years when hormones rage and oral hygiene often slips. HIV positive patients face special challenges with 2 to 3 times higher risk. These numbers aren't meant to scare you, but to show that gum disease is an extremely common, often overlooked problem that deserves our attention, no matter where we live or what our circumstances might be. Chronic gingivitis shows itself through several telltale signs. First, it's bleeding. Your gums shouldn't bleed any more than your skin would from gentle touching. Next is color change, from healthy coral pink to angry red or even bluish purple in severe cases. The texture changes too. Instead of being firm like an orange peel, inflamed gum becomes soft like overripe peaches. You might notice bad breath that won't go away. This comes from bacteria living in those deep pockets. Let's focus on puberty-associated gingivitis, which deserves special attention. Imagine your body during puberty as a construction site. Hormones are the busy workers causing all sorts of changes. These hormonal changes make gum tissue more sensitive to plaque. It's like turning up the volume on your body's inflammatory response. Add in common teenage factors like braces, which create plaque traps, energy drinks, high acidity, and inconsistent oral care, and you have got a perfect storm for gum problems. Girls tend to be slightly more affected because estrogen basically increases gum tissue sensitivity. Gingival epulis is essentially a gum overgrowth that forms in response to chronic irritation. Think of it like colors forming on your hand from repeated friction. These growths typically range from the size of a pea to a large grape, and while they are not cancerous, they can cause significant problems. They often form near areas with dental calculus, tatter, or rough feelings that can constantly irritate the tissue. Here is the key point. Gingival epulis is essentially a reactive overgrowth caused by chronic irritation, much like how your skin develops callus from constant rubbing. The main culprit, dental plaque, tatter buildup, or rough edge from filling dentures that act like sandpaper against your gum. That's why simply removing the growth isn't enough. Unless we eliminate these underlying irritants, think professional cleaning, smoothing rough dental work. It's like cutting weeds without pulling the roots. They will just grow back. Now, let's discuss periodontitis, where the problem moves beyond gums to attack the bone itself. Picture this. The bacteria in plaque produce toxins that trigger our immune system. In trying to defend us, our body actually destroys its own bone. It's like burning down a village to stop an invading army. The damage happens in waves of activity, with periods of destruction followed by relative calm. In Africa, we see particularly high rates in rural areas where access to care is limited and traditional diets have been replaced by more processed foods. Think of your gums like a sweater sleeve hugging your wrist. Healthy 1 to 3 millimeters probing depth. The sleeve cuff naturally rises 1 to 3 millimeters above your wrist bone. Snug but movable like a watch strap. Stage 1 to 2 millimeters attachment loss. The cuff gets stretched downward 1 to 2 millimeters, exposing skin between its original position and current edge. The sleeve's opening, probing depth may still be 3 millimeters, but the fabric's anchor has slipped. Stage 2, sleeve slides to mid-forearm, 3 to 4 millimeters detachment. Stage 3, sleeve tears past elbow. Stage 4, sleeve thrashed, risking button loss, teeth falling out. Necrotizing periodontal diseases are among the most urgent conditions we see in dentistry. The term necrotizing means tissue death. Imagine your gum tissue literally rotting away due to bacterial toxins. These infections often start suddenly with excruciating pain, foul taste, and crater, like ulcers between teeth. For HIV patients, the risk is particularly higher, about 10% develop NG, showing how closely oral health ties to immune function. Periodontitis as a manifestation of systemic diseases. When gum disease appears as part of a systemic condition, it's often your body's early warning system. For leukemia patients, gums may swell and bleed excessively because the blood can't form proper clots. It's like having faulty plumbing where pipes leak everywhere. With diabetes, high blood sugar creates a perfect environment for infections while impairing healing. Imagine trying to put out a fire with gasoline nearby. Through our 3-part series on dental health, I hope you have gained a stronger commitment to oral care. Greenwell's products offer comprehensive protection, herb toothpaste, a natural formula enriched with botanical extracts clinically proven to reduce gum inflammation and inhibit plaque buildup, supporting daily gum health maintenance. Propolis Plus capsule contains potent bee propolis extract with antibacterial and anti-inflammatory propolis. Mix the capsule contents with water and apply topically to gums to promote tissue repair, ideal for sensitive or inflamed areas. Super Cocoa 10 capsule targets periodontal tissue regeneration by enhancing cellular energy metabolism, improving microcirculation in the gums, designed for topical use to reduce pocket depth in periodontitis care. Okay, as we conclude, let me leave you with this thought. Your mouth is the gateway to your body, and gum health is the gatekeeper. While we have covered complex topics today, the prevention formula remains beautifully simple. Brush like you are massaging rather than scrubbing. Clean between teeth daily and visit your dental team regularly. Watch for warning signs like bleeding or persistent bad breath. Remember that gum disease is largely preventable, and even when it occurs, early intervention can stop progression. Thanks for your listening. Okay, thank you. See you next time. Thank you.
Thank you, Linda. Thank you for your presentation. So I have answered nearly all the answers in the chat box. Yeah. If there's no more questions, we can call it a day, maybe. Thank you, everyone, for joining us today. Thank you.
All right, thank you. Thank you, Miss Adrien. Thank you, Miss Linda. Today we have learned a lot, especially about the dental challenge, the dental health. And the good thing is we have the solution. We can use herbal toothpaste, we can use Propolis Plus and many other products that has been introduced and explained very well by Miss Adrien and also Miss Linda. So I think today we have learned a lot. Thank you very much, Miss Linda and Miss Adrien, for your wonderful training. We really appreciate. We wish that we can learn more from both of you in a very uh, near future. So we will always welcome Miss Adrien and Miss Linda to give us more knowledge about health and also how green work products can help to solve those challenges. So I think, ladies and gentlemen, today we can round up. So we can unmute ourselves and then we say thank you to Miss Shadreen and Miss Linda. And we can say bye-bye and have a nice weekend. Thank you.
Good night. Much. Thank you. Bye-bye. Night.
Thank you, Madam Satrin. Thank you, Linda.
Thank you.
Thank you.
Thank
Thank you
you,
very
Mr.
much.
Budiman.
Thank you and
Thank
good
you.
night.
Have a nice weekend.
Thank you very much. Thank you very much.
You too.
Thank you, guys. See you.
Okay, bye-bye. Thank you.
Take care.
Bye.